Did you know that bladder urgency signals come in waves, where the urgency grows and then peaks before diminishing again? In this video, I'm going to share 5 simple tricks to inhibit bladder urgency, reducing the peak of this wave and easing your symptoms. These tricks are a way for you to communicate with your nervous system, telling it to calm your bladder so that you can go about your day. I'm also going to add some bonus tips to help you with nighttime urgency, so make sure to stick around for those. The first trick is to perform pelvic floor muscle contractions. By contracting the external urethral sphincter, you're tapping into the guarding reflex, sending a message to the nervous system to relax the bladder. This technique is really helpful if your symptoms are being caused by bladder contractions. The second trick is to assume a pose I like to call Supta Gummy Bear. In this pose, you're going to sit down and relax back into a chair. Allow your legs to be a little wider than hip distance apart, let your belly hang and let your pelvic floor be soft, letting go of all your tension. This may feel counterintuitive to relax when you feel urgency, but if your urgency is being caused by pelvic tension, this sends a signal to the nervous system to relax the muscles around the hips and pelvis to allow the urgency to subside. The third trick is to do heel raises. These are best done sitting upright in a chair with your hands resting on your knee. Just lift and lower your heels 10 times while remaining calm. This is believed to send an interruptive signal to the nervous system because the nerves that control the plantar flexion are on the same branches as those that control your bladder. The fourth trick is a breathing technique that taps into the rest and digest mode of your nervous system. For this, you should inhale deeply for a count of 4 and exhale slowly for a count of 8, repeating for 10 full breath cycles. This trick is helpful if your urgency is being triggered by stress or anxiety. The fifth trick is mental distraction, and this is another way to interrupt the focus of your nervous system. For best distraction, you should do something that involves both intensity of thought and physical movement with your hands. A Rubik's Cube is a great example, but you might not always have a cube to hand. So another example would be to count to 10 in another language while doing some sort of a digit exercise where you touch your fingers to your thumbs. When you get familiar with that language, you can change to a new language to make it more challenging. Then there's the bonus tips for nighttime voiding. If you've been struggling with waking during the night to pee, you should have your last drink about 2 to 3 hours before bed, and right after that last drink, you can perform the legs up the wall pose for about 10 minutes. By elevating the legs in this way, you're encouraging excess fluids to drain from the legs, allowing the kidneys to process those fluids so that you can pee them out before you go to sleep. If you happen to wake feeling an urgency, you can use similar tricks as those during the day. So you can perform some pelvic floor exercises, you can do some heel raises by pointing and flexing your toes but lying down. You can try some calm breathing, particularly if you're feeling anxious. And to try some distraction, you could maybe try counting some sheep. It's okay to go back to sleep after riding the urgency wave. You don't have to get up, but if you do, you should wait until after the urgency has subsided. All of the techniques to inhibit bladder urgency can be viewed as tools to communicate with your nervous system. When the urgency is gone, your nervous system feels safe, and that's when you should go to the bathroom to empty. You're less likely to leak when you aren't riding the urgency wave and more likely to have a happy bladder. It is so much easier to overcome overactive bladder if you're urinating in a calm state rather than always rushing to the bathroom in a panicked urgency state. Once you've learned to inhibit urgency and have some control over your bladder, you should notice that the overactivity starts to calm down. This is when you're going to meet the biggest challenge for someone who's working to overcome overactive bladder, and that is learning to read your bladder signals to know when it's actually time to pee. And that's what I'm talking about in this next video. So click through and watch that if you've been working on overcoming urgency, frequency, and an overactive bladder, because this will make a big difference to your success.